Friends, today we are going to see all these three topics: septal abscess, perforation of the nasal septum, and fracture of the nasal septum. In previous video, we have covered deviated nasal septums. One thing is the deviated nasal septum, and second is the septal hematoma. Okay, so these two topics, these two are the disorders of the nasal septum we have covered so far. Okay, so now we are starting with the septal abscess, right? So in the septal abscess, as you know, in the previous video, what I have told you, the complications of the septal hematoma. Septal hematoma. Okay, if this septal hematoma is goes unknown, okay, and if there is secondary bacterial infections, it lead to cause septal abscess. Okay, so what is the etiology? Etiology is the secondary infection in the septal hematoma. That is the etiology, right? And the second thing is, if there is acute infections, right? If there is a acute infection, in case of like tuberculosis, okay, septal abscess will be seen. And one thing is the furuncles, right? At furuncles we have seen in the external auditory canal. Okay, there is the infection of the hair cells. Okay, hair is also here present. So furuncles of nose, it also causes the septal abscess, right? Now the septal abscess, and I think you all remember the septal hematoma. Okay, so in the septal hematoma, what we have seen like this. This is the cavity, and here is the nasal septum. Normally, here is the nasal septum is present. Okay, in this in nasal hematoma, what happening? It's collection of the blood in the mucoperichondrium or mucoperiosteum. Okay, so it's going like this, right? It's going like this. What is this? This is the blood one, and that is called septal hematoma. So what happens if there is an infection? If here is an infection, okay, that is like septal abscess, right? So in septal abscess, what happening? See, here is the swelling. Okay, if we go through the internal examination, we have to see inside the nose, right? So in nostril or in the nasal cavity, in both sides, what will happen? There is swelling. Okay, and like this. Okay, so what happening? What is the clinical feature of this? Can you tell me for this what? Nasal obstruction. So how? Bilateral nasal obstruction, and it is the very severe bilateral nasal obstruction. Am I? So patient is complaining severe bilateral nasal obstruction. Can you tell me? Septal abscess if there is the infection, am I right? There is infection. If there is infection, so fever. How this fever will come? Tell me. This fever and frontal headache. Frontal headache. Okay. Examiner will ask. Okay. Why this fever and this is frontal headache? Okay. Think. Now, in a septal abscess, if there is a septal abscess, okay, these all are the clinical features. Okay, and the severe bilateral nasal obstruction with pain. Okay, patient is complaining about pain, right? This is the one swelling. Okay, so what happening in this fluctuations? Okay, you can see the fluctuations. Fluctuations can be seen. Okay, so I am writing fluctuations. Fluctuation test. Okay, it can be positive, right? What is the fluctuation? I hope you all know the fluctuation. Okay, if you press from one side, okay, in another side you will feel that swelling. Okay, that is a fluctuation test, and it will be positive for this septal abscess. Okay, so a headache and a fever, right? This will be the frontal headache. Okay, what are the causes for the frontal headache? You know, any bacterial infections, okay, any bacterial viral infection, okay, any infection is, if there is any infection, okay, or if there is any vascular abnormalities, right, so this frontal headache will come, okay, and this fever, okay, there is the bacterial infections, okay, so the fragment of the rectal segments and how to tell. Okay, it will enter into the body, right? So there will be the mechanism, okay, that will activate, and that is called the that will lead to this fever, right? Now, what is the septal abscess? Now, what is the treatment for this septal abscess? What is the treatment? Treatment is treatment. So this treatment, what there is septal abscess, right? It has to be drained. Okay, in the septal hematoma, what I told, wherever blood collection in our body, it has to be drained, right? So drain. Okay, we have to make one incision. Okay, where we have to make incision? We have to make incision on the dependent part of the septal abscess. If this is your nasal abscess, okay, either side, okay. If it is here, if it is prominent in here, so we have to make incision along this side. So, okay, if it is prominent here, we have to make incisions here. Okay, so it's depend on the depending factor is the nasal abscess, where it's more correct. Okay, through that we have to make one incision. Okay, and what happening actually in the septal abscess condition? This is the cartilage part. Am I right? So this is the cartilage part, and this cartilage part, necrosis of the cartilage. Yes. Necrosis of cartilage part, cartilage of this nasal septum. So there is a necrosis, right? So if there is a necrosis, okay, what is the complications? Okay, before going on the treatment, I would love to mention some complications. Okay, can you tell me the complications? One thing, you just see here, necrosis of the cartilage part. It's happening in the septal abscess. If there is a necrosis, okay, you tell me this is the dorsum. Am I right? This is the dorsum. So this dorsum is situated on the cartilage and the bony part. If there is the cartilage part is going to destroy, or there is necrosis, there is no cartilage part. So the supratip will be depressed. Okay, so supratip depression. Right? So what will happen? External deformities will be there. Right? Now one thing, if nasal cartilage is going to destroy, see, this is the nasal cartilage. Am I right? Nasal cartilage or bony part. Okay, I am talking about nasal septum, and there is what? Flap. There is flap. Okay, if it's nasal abscess, if it's affecting this flap, this rectal flap, what is that? That is a mucopericondyl and a mucoperiosteum. If it is affecting this, okay, so what will happen? It will be like this. Am I right? See, this is the cartilage part, it's going to necrosis. If it is affecting this part, so it will be like this. So what is this? This is the perforations. Okay, so can I tell? Perforations is also. Perforation is also a complications of the septal abscess. So these are the complications. Okay, external deformities you can add here. External deformities, supratip depressions, and the perforations. Okay, this is happening in the septal abscess. Now, what is the treatment? Treatment drainage. Okay, it's incision made around the dependent part of the septal abscess. That finish. Now, what happening? We have to reopen incision. Okay, for every day, for 2 to 3 days. Okay, for 2 to 3 days. In every day we have to reopen that incision to drain the if there is any pus collection. For example, today we drain all the parts. All the drainage. We have done it. Okay. Now tomorrow we have also reopened. If there is any pus collection or any abscess, okay, also we have to drain it. Okay. Now in this what happening? See here, necrosis of the cartilage part. Okay. So there is some fragment. Okay. So fragment. Maybe there. Okay, so this fragment and some other parts. Okay, we can drain it, or we can use one suction tubes. Okay, due to that we can remove this. Okay, so this drainage is the very important thing. Okay, and after that what we have to give in the treatment, that is the antibiotics. Antibiotics. Okay, so antibiotics we should give as soon as possible once the diagnosis has confirmed. Okay, so this is all about the septal abscess. Okay, so These all are things. One thing is fever and all, and one more symptoms that is called. There will be the tenderness along the dorsum part. Okay, so tenderness will be present, right? So I am going to remove this part. Okay, so this all about the septal abscess. We have to give systemic antibiotics, right? Systemic antibiotics we must give. So it's all about the septal abscess. We are going to see now perforation of the nasal septum. So perforation, we are going to start perforation. Perforations. Okay. What is the perforations of nasal septum? Can you tell me? See, if there is any perforation in the medial line of the septal cartilage. Okay. See, the septal cartilage. As you know, the septal cartilage. Here is the septal cartilage. Am I right? This is what? This is the septal cartilage. Here it's like. This is the septal cartilage. Okay. So this is the cartilage part, and here is the bony part. Okay. Perpendicular to the ephemeris and the womb. Okay. Leave it. So perforations. Any perforation in the midline of the septal cartilage, that is the perforation of the nasal septum. Now, why this perforations is occurring? Can you tell me why this perforation is occurring? Can I tell? One thing is due to the what we have seen here, septal abscess. So one thing is the septal abscess. Okay. So septal abscess. Due to. Can you tell me some other things? Yes. Granulomatous disease. Granulomatous disease. Can you give me the example? Yes. See, TB. Okay. Leprosy. Am I right? TB. One thing is the leprosy. These all are the what? Granulomatous disease. Okay. And syphilis also. Syphilis also. It's there. Syphilis also can cause perforation of the nasal septum. Okay. And rhinolith. One word is the rhinolith. What is the rhinolith? What is the rhinolith? Rhinolith is the stone present in the nasal cavity. Okay. We will talk on the rhinolith separately. Okay, in one lecture. Okay. So these are the causes. Okay. Syphilis, TB, leprosy. Okay. So these are the causes. And some there is some drugs. If you are addicted to the cocaine addicts, okay, one thing. And second thing is, if you are using steroids for the nasal spray, right? Steroids can also cause steroids for the nose. Whatever we are using for a nasal cavity steroids, that can lead to this. Okay, there is some occupational things is also like occupation. Like if you are working in like sodium carbonate factories, right? That is called soda ash. Okay, if you are working in that, okay, in the arsenic, okay, so it will be these all are the positive. These all are the etiology, right? And heredity is we can't say, but these all are the things. Okay. Now, perforation of the nasal septum. You know this is the cartilage part and this is the bony part, right? So can I divide it into two parts? Can I divide it into two parts? Okay, there is one is the perforation in the cartilage part, right? And second is the perforation in the bony part. Bony part. Okay. So maximum perforations, 90% perforation is the it's occurring in the cartilage part only. Okay. But examiner will ask one question. Okay. Examiner will ask one question. Tell me condition in that bony perforations of the nasal septum is seen. Okay, that is the syphilis. That is called syphilis. Okay, make a note on this. It's very important MCQ. In the case of syphilis only. Okay, in the case of syphilis only, this bony perforations is we can see. Okay, so these all are the perforation of the nasal nasal septum. Okay. Now, can you tell me what will have how patient will present with the perforation of the nasal septums? See here. Oh, sorry, I removed this. I should not remove. This is the only, right? So this part, okay. If there is perforations, now listen very carefully. If there is perforations, okay, what happening? If perforations is small, if it is small, now talking about perforation, okay. If this perforation is small and one it is large, right? So what will happen? If there is small perforations like this dot, okay. If there is small perforations, what will happen? Nothing. Okay, patient can tolerate. Okay, but what happen? Air will move from one nostril to the another nostril. Okay, there is this is what perforation in the nasal septum. So air will move from the one nostril to the another nostril. Okay, and there will be one sound. Okay, whistling sound will be seen in those patients. But if the perforation is the large, what we have to do? If perforation is large, what will happen when gases will enter from here? Okay, edge of this perforations, it will convert into one crust like, okay, dry crust. So crust means dry only, okay. So it will make one crust like structures surrounding this perforations, right? So what will happen? Patient is thinking there is something like foreign body or like that, okay. So patient want to remove that, okay, and there will be epistaxis, okay, nose bleeding once patient is removing that. Why? Because actually patient is removing what? The part of the cartilage, or you can tell there is a mucus lining he is removing, okay, and there is a liquid, right? Okay, so only bleeding is occurring, okay. So recurrent bleedings, okay. So recurrent bleeding, okay, patient present with the recurrent bleeding in the case of this, okay, and this crust, what it does, okay, nasal obstruction also. So nasal obstruction is also, okay. So this due to this crust only, this is all happening. Am I right? Yes. So recurrent bleeding and the nasal obstruction, okay. Here will be paining will be there, right? So these are the clinical features in the perforation of the nasal septum. You have to remember this point. In the case of bony, in the case of the syphilis, okay. One more in etiology, one disease like Wegener disease, right? That is a granulomatous disease, and in this what happening? Full cartilage part get necrosis of the full cartilage part. Okay, so there is no necrosis. Okay, so this is what is the treatment? What is the treatment? Okay, can you tell me the treatment? Okay, so in the treatment, what we have is here is the perforation of the nasal septum. If there is a small perforation, no problem. If there is a large perforation, this, okay, what we have to use? We have to one things that is called silicone obturators. Okay, silicone obturators. Obturators is the things which will block this, this perforations, right? It will block this perforations. And why we are using silicone? Because it is a non-allergic material, right? Whenever we are transferring anything in our body, or we are going to interfere in our body, okay, there will be the what? Allergic reaction will be there, right? So if we put this silicone, nothing will happen, okay, because this is the non-allergic material, okay. So this is like a button-like structure, button-like structure, this short button-like structure, and we have to press here, right? So patient will symptoms of the patient will improve, right? So this is what we have to do in the silicone obturators, okay. Other things like antibiotics and antibiotics you can give, right? So this is the perforation of the nasal septums, right? Now we have to see the fractures of the nasal septum. So fractures of the nasal septums. Fractures of the nasal septums. It is divided into two parts. Rhinolith, we will see it later. Okay. While removing this rhinoliths, okay, perforations may be occurs. And one more thing, sir, I would like to tell you this perforation of the nasal cavity, this perforations, one thing. I have told you everything, but one very important thing I forgot. Oh, sorry for that. It is the heterogenic. It is the heterogenic. Okay, so what is this? This is the surgeon induced. Surgeon induced. How? How? When ENT surgeon, if they are not lifting the flap very carefully, okay, it will damage the cartilage part and it will lead to perforations. Okay, so SMR, submucosal resection, and septoplasty. Septoplasty, in this surgery we can see this perforations. Okay, but the ratio is in the SMR it's more we can see than septoplasty. Why? I will teach SMR and septoplasty later, right? So in the SMR what we are going to do, if it is the nasal septum, here remember, if it is the nasal septum, am I right? Septum. So this is what? This is the covering mucoperichondrial and mucoperiosteal. Am I right? Yes. So what we are going to, in SMR surgeon, what we are going to do? They are removing from both sides. From both sides. It's like this. Am I right? So it's like this only. Okay. So since they are removing from the both sides, okay, so perforations can be occurs. But in septoplasty, what happening? There is the covering. But surgeon is want to remove this only. Am I right? So from one side. Okay, that's why SMR in the SMR perforation chances is the very high. Okay, so this is the one things I want to tell you. Okay, so this is all. Now fracture of the nasal fractures of the nasal septums. Now fractures. It is of two types. This fractures is of two types. One is the Jarjavé and second is the Chivet, right? So one is the Jarjavé and second is Chivet. In this what happening? In the Jarjavé, force is giving from the front, right? So force is giving from the front and in this force is giving from the below. See, now you think if somebody is giving pressure from the front, okay, what will happen? Pressure will transfer to the another sections. Okay, so horizontal, its force is coming like this. Okay, so horizontal, what will happen? Horizontal fractures will be occurs. Am I right? And here is what? Here is the vertical fracture will be occurs. Okay, I want to draw it here. See here, it is like this. Am I right? And here is, it is like this. Okay, so what happening? Here is the markings. This is the athament plate. Here is the vomer, right? And this is the cartilage part. Am I right? So if you are giving pressures from the anterior or from the front, what will happen? It will go like this. Okay, so fracture starts from the anterior nasal crest, right? From the anterior nasal spine bone, right? So anterior from here to it will go to the hair. Okay, junction of the cartilage and the vomer, just above the junction of the cartilage and vomer. If you are giving force from the vertically, right? So it will go from here, anterior nasal spine. Okay, crest of this, it will go here and it will go like this vertically. And up to this, what is this? This is the dorsum. So this is the cartilage part and here is the bony part. Here is the nasal bone, right? So junction of the bony and the cartilage part, it will go vertically, right? So this is what happening in this and this condition. Okay. So what happening? These two things are over, right? Now this all things has been over. One thing I want to tell you, in the septal hematoma, which we covered last in the previous lecture. Okay, what is the treatment for that? Treatment I already told you, but here I am also explaining just for 1 minute. Okay, so what is the treatment for septal hematoma? It should be drained, right? Yes, it should be drained. After that, what we have to do? We have to pack this nasal cavity, right, for the 48 hours. For the 48 hours. Okay, we have to pack the nasal cavity for the 48 hours. Why? To prevent to prevent reaccumulation of the blood. Am I right? To prevent reaccumulation of the blood. Okay. And the second thing, we have to give what? Antibiotics. Antibiotics, right? Why we? Because there is septal hematoma is there. Okay. We are giving systemic antibiotics. Okay. Because to prevent the abscess. Okay. So only we are giving this antibiotics. Okay. So if examiner is asking what is the treatment of septal hematoma, you tell sir it should be the drain. Okay. And incision made along with the floor of the nose. Okay, or nasal cavity. Okay. So we have to make the incision 48 hours. We have to pack the nose to prevent the reaccumulations, and the antibiotics it should be given. Okay. So these all the things. Whatever I want to explain, I have explained. So this all things related to the diseases of the septal nasal septum, and it is diseases of the septal nasal septums. Okay. So in the next video, I will cover the SMR surgery and the septoplasty. Okay. So up to that, thank you. Okay. So septoplasty, and after that there is so many topics. Okay. So we will cover it. Okay. So thank you. Thank you.